wanted to hold off having a peg as long as possible and to carry on feeding Isabella orally. However, that got brought forward by probably about 3 or 4 months earlier than what we wanted to happen. But at the time, it couldn't have come quick enough.
Yeah, feeding was becoming a really desperate situation and really hard work for Isabella. So there was no choice in the matter. She had to have a peg, or that would be the end of her life.
With Amelie's feeding, we were lucky, and at the time we felt unlucky. We went in for a routine video fluoroscopy for her, just to check out her swallow. And this was on the dreaded kind of Friday afternoon for that procedure. Next thing we know, we're being told that we can't take her home, she needs to have feeding intervention. We're going to put an NG tube in because she's at risk of aspiring when she feeds. And at the time, it was awful. But looking back, it's probably one of the best decisions that happened for us and for her, because we never had that worry with her feeding. Yeah, at the time she was slow at chewing, but she never really had any issues with swallowing too much. She wasn't ever really aspiring when she ate. It was more the risk of why they wanted to intervene now, so we can maintain her chest integrity, which, touch wood, has been fine today. She doesn't particularly get bad chest infections. She gets the odd cold and flu. But I think because we intervened that early with her feeding, she didn't have any of those other issues. And because also it meant she was getting the right calorie amount, she continued to grow. She had no failure to thrive issues that some of the kids get because they take so long to feed, or spending 3 hours at the dinner. We never had those problems. It's kind of those added stresses that other families go through. So at the time we thought it was very early, but looking back, it's probably the best thing that happened. And with the NG tube, we then were very lucky to get her to have a peg very quickly, probably within about a month, was it? Mm. Yeah, that she had a peg, which has probably been the best decision as well, because it's very easy to administer all of her medications and to make sure she gets to feed. And obviously with the ketogenic diet, we need to make sure that all of her medication is sugar-free. So all these other complications, which would be very difficult, I think, if we were feeding her orally, or even by the NG tube, because it's much more labour.
We fed Ruby by mouth for as long as we could, and probably longer than the doctors liked us to, but I liked to feed her by mouth because she could taste things, and that was one sense that she did have quite strongly. So we continued to do that, and even after she got her Gtube in her tummy, we continued to feed her tastes by mouth, not large volumes that went through her tube, but we still continued to give her taste when it was safe around secretions and airway issues.
He ate up to 3 years old, and it was very hard for me to give him a Gtube. I was crying, and I hate every doctor who told me that he had to have it. But now it's wonderful.
I spoke to a lot of parents about the peg, and most of them say it's the most horrific decision they had to make. And although of course it is very difficult, I didn't feel that way. When Amelie had the video fluoroscopy, she was eating well. I think she had a meat stew the night before, but she did cough after she fed. And that was because she started to not be able to direct her food where she should. And the doctor said something to us that it was very important, which was it's not comfortable for her what she's doing. And in fact, we did do that. We did eat and cough after every mouthful. And it is extremely uncomfortable. And I thought, actually, I'd rather she keeps a memory of what it is to eat nicely than to go through feeding and not enjoy it and coughing all the time and not having that good memory of something that is so nice and that she enjoyed so much. And obviously also the safety behind it, that in the long term this was the best for her in terms of keeping her comfortable and making sure that we were giving her the best possibility in keeping her healthy and not having to deal with chest infections as much, and I think that was for us really important. So I was sad, but I did not think that it was the worst that could happen to her, because actually it made a huge difference in the long run for Emily.
I'm going with hope. I pushed for a peg as soon as I found out about the Tay-Sachs, because inevitably she was going to need this, so let's do it while she's well enough to withstand an operation, and to use it as and when needed. First of all, starting with meds and then introducing food at a later date as her swallowing got weaker.